Hello, my name is Dr. Ruth Vine, and today I'm speaking to you from Ngunnawal country. Welcome to another Mental Health Monday segment. Today I thought I'd like to talk to you about eating disorders. Eating disorders can be serious mental illnesses and are much more common than you might think, with data suggesting that approximately 1.2 million Australians currently live with an eating disorder, some of that very severe. Unhealthy eating behaviours and obsessive thoughts about food can be indicators of this complex issue. And often people with an eating disorder also suffer from coexisting mental illnesses like depression or anxiety. Eating disorders are not a sign of vanity or a desire for attention. They may be a coping mechanism for underlying emotional issues, including low self-esteem, anxiety, or trauma. Sometimes they're a way for the person to feel a sense of control in their lives. Also, having an eating disorder may make a person feel like they've lost control of their body and their behaviours. It's important to raise awareness of harmful misconceptions and stigmas about eating disorders so that we can recognise if we or someone close to us may be showing symptoms of an eating disorder. A person's eating disorder can often come to light at this time of year as people gather to celebrate and there is this additional focus on eating. Changes to a person's normal routine and increased social expectations may also cause people to feel more anxious. So an increased focus on food and sharing food with others is often a central part of holiday celebrations, and if you do have an eating disorder, this can be tricky to navigate. Family and friends can mean well by commenting on a person's appearance, especially if they haven't seen each other recently. But those sort of appearance-related comments can be triggering for those with an eating disorder or body image concerns. If you or someone close to you has an eating disorder or is in recovery from an eating disorder, it's important to plan ahead and try and prepare some strategies for managing those sort of public eating situations. This might include thinking about different ways to provide security around food and meals, anticipating potential triggers, trying to keep to a normal food routine where possible, and in social situations considering seating arrangements to allow you or others to sit near people you feel most comfortable with. Eating disorders can be scary to observe in someone you care about, but early identification can help prevent, and your support can make a big difference in their recovery. So if you notice someone who you think is showing signs of an eating disorder, I know it can be difficult to know how to start a conversation. Getting to know more and understanding more about mental health and eating disorders might help you start those conversations with compassion and empathy and avoid harmful language or misconceptions. If you want to know more about eating disorders and how you can better support yourself or those close to you, there are a range of resources and online information available. For starts, I'd encourage you to visit the Head to Health website. You can access a range of digital resources and information on mental health and eating disorder supports. The website is www.head2health.gov.au, and that website is updated regularly as more support services and resources become available. There's also a National Eating Disorders Collaboration and a Butterfly Foundation websites, and they can help provide information about eating disorders, including how to approach having conversations with those you're worried about. Your mental health is important. Some days are daunting, some seem overwhelming, and you may require more support than other days. Please remember, help is available and it's absolutely possible to fully recover from an eating disorder. If you or those close to you need help, you can also make an appointment with your general practitioner, visit a Head to Health centre if there is one in your area, or a Headspace centre. Call the Butterfly National phone line on 1800 ED HOPE or contact Eating Disorders Families Australia. There are skilled staff to speak with and a range of supports available for people with an eating disorder. That includes general information, education, counselling sessions, and there are also subsidised treatment sessions and more. Remember, you're never alone, and it's important to feel able to ask for help and to take the first steps in getting help. Eating disorders are complex, but recovery is possible. Thank you very much.